Hi, good morning to all of you. Welcome to another session of RUMC Alumni webinar session. With us today, we have Dr. Tan and Keong, our alumni from class of 2007. And then we have also Ms. Raji, our head of marketing. Before we start, there's a bit of housekeeping briefing. So you can see your control panel on your either left or your right hand side. And then you can post your questions at the questions panel in your control panel. And then for the benefit of everybody, all of the attendees are muted, but you can post all your questions anytime and we will attend to it accordingly. All right, without further delay, we'll have first Ms. Raji to introduce, to have a few words to say before we start the webinar. Over to you, Raji.
Okay, thank you, Faraz. Good morning, everyone. I'm Raji, Head of Marketing at RCSI UCD Malaysia campus. We are very delighted to have all of you here attending our Alumni Series webinar. We have been doing webinars with our alumni in the last few months, especially during this MCO period, to give you, to feed you with the right information and to give you more insights about our program and also the practice of our current alumni, right? We are very privileged today to have Dr. Tan and Keong, RUMC alumni class of 2007. Dr. Tan had done his internship in Singapore, practice in Ireland, and now he's working as an endocrinologist in the US. So I'm very, very happy today to introduce Dr. Tan to you. He's going to be sharing a lot of insights on his on the USMLE practice as well as his road/travel experience that he's taken in the last many years, I think, Dr. Tan. So without further ado, let's hear it from Dr. Tan. Over to you, Dr. Tan.
Okay. Good morning, everyone. So as mentioned, I was a graduate from class 2007, and today I'm going to share with you my experience and also give you some insight about how to apply for various positions in Ireland as well as in the US. So previously, I was an intern in Singapore, working in Changi Hospital as well as Singapore General Hospital, and subsequently I proceeded to go to Ireland for SHO internal medicine training with Trinity College University. And during that period of time, that's when I started applying for US MLA as well as finished the US MLA. During that period of time as well, I finished the MRCPA at the same time. So I went through the residency program in internal medicine with Bay State Medical Center in Massachusetts, and subsequently entered the endocrine fellowship with Harbor UCLA City of Hope in California. Currently, I'm practicing in Carson City in Nevada State as an endocrinologist. Next. So these are some of the research that I've done throughout my career. As you can see, when I was studying in Ireland, I have the privilege to apply for a research project. So in Ireland, they offer a summer research project for medical students as well as all the Bachelor of Science students to apply for. So that gives you an opportunity to do research with the institutions, and I managed to have grabbed myself a research project with the Department of Pharmacology, and that subsequently helped me to achieve the Bachelor of Medical Science by finishing up with the thesis and obtain another degree in addition to the medical degree. Subsequently, during my training in Ireland, I have done some research doing an audit for diabetes ketoacidosis treatment in Drogheda General Hospital, as well as during my residency in America, I have done a couple of research as listed here, and I won't bore you with all the detail, but what I'm trying to say is that along the way, you have opportunity to be involved in research. Next. Obviously, with research, there are opportunity with publications, and these are some of the publications that I have done through my year of trainings, and I won't bore you with the detail. Next. So as far as awards, so in 2004, with my research project for the summer holiday, I was selected as one of the finalists to present for the Watts Medal in 2005 for the RUMC Winter Meeting in Ireland. And 2007, upon graduation, I obtained the gold medalist for the general surgery in PMC or RUMC. And then I obtained my RCPI membership in Ireland in 2012, and in 2016, as a resident, I won the first prize resident poster in American Geriatric Society annual conference. Next. And then these are some of the poster presentation as well as oral presentation that I have participated during my residency as well as my fellowship in America. And I'm just sharing with you on the slides. Next. So having shown you all what you can achieve when you advance your career, and I'm just going to kind of share with you my personal journey very quickly. As I mentioned just now, I graduated back in 2007. I joined Sync Health for internship in Singapore for a year, and subsequently I went over to Ireland to start a standalone SHO position before obtaining the positions to join the Trinity SHO training program for 2 years in durations. Subsequently, during that, after the training, I joined Hermitage Medical Center, which is a private hospital in Ireland, for a year, so that I can actually obtain my USMA credential as well as my MRCP of Ireland. And on my final year in Ireland, I worked as an endocrinology registrar before I head over to America for my residency. And I will talk to you more detail about what residency in America later on. So next. So let's just start with Ireland. So in Ireland, the internship program at that point when I graduated was very limited. However, the SHO positions are very abundant. So that's why I end up in Singapore for a year as an intern before I head over to Ireland to get a job. In Ireland, there are two types of job. So SHO and registrar both have standalone. For SHO, the standalone is about 6 months contract. For in training is about 2 years in internal medicine. For surgery, I believe is 2 years as well. As a registrar, you have a standalone job contracting for 1 year. And in the SPR, which is a specialist registrar positions, is 5 years in total. As far as I know, I will pass you on to Reggie how RUMC currently is helping the graduates to obtain internship positions. So I will just pass it on to Reggie.
As of now, we understand that a lot of students have actually expressed interest to pursue their internship in Ireland. So what we have done now, our students who complete the RCSI UCD Malaysia campus medical degree would have to take a very short exam before they can qualify to apply for an internship in Ireland. So the exam is known as IEET exams. This is to test your knowledge on the Irish healthcare system. Last few years, all these years, students would have to go to Ireland to take these exams. So what we have done from this year onward is to help the students, especially those who are based in Malaysia, and also because you'll be completing your clinical studies in Penang. So we are going to be starting this exams in Penang itself. So you don't have to travel all the way to Ireland to do your to take on the exams to qualify to apply for your internship. So that is one of the advantages from now on, and we have also moved our graduation to be a bit more earlier so that our students can will have the time to would be qualified to apply for the internship in a timely manner. So that is something that I thought I should share with you guys. We know there are some prospective students here thinking about our program. This year we've had quite a number of students who have applied for the internships in Ireland. I would safely say that about 80% of them got into the internships, and they're already doing their internships in Ireland at the moment. On to Dr. Tan.
Okay, thank you.
Thanks, Dr. Tan.
No problem. So next. So So let me just kind of talk you through from my personal experience in internal medicine, how you can progress your career in Ireland. So essentially, as the SHO in training, you are qualified to take MRCP Ireland as your entry exam for your specialty training, if that's what you wish to pursue. So MRCPI had three parts. Part one is basically the clinical knowledge, and part two, you have a written portion as well as the clinical portions. So essentially, this is like a replication of what your medical school exams are, apart from, just like your OSCE, which is reflecting in the clinical part, as well as all your clinical exam, clinical knowledge exam in the format of the multiple choice exams. MRCPI, unfortunately, since I think 2007 and 2008, had not been recognized in UK. So people, when they wanted to go to UK to work, they have to take the MRCP, those in UK itself. So you have MRCP London, MRCP Scotland, as well as I believe there is another one that I can't remember. So those are the pathway for you to complete so that you can apply for specialty training. And in Ireland, the specialty training obviously will be applying for the SPR job, the specialist registrar positions, which will last for 5 years. And upon finishing, you are qualified to apply for consultancy positions. So give and take the whole time frame of from the moment you graduate from medical school to the earliest that you can get a consultancy position in Ireland would be roughly about 10 years time. Next. So MRCPI generally have about 3 to 4 exam sessions per year. And those are the dates that I obtained from the website for 2020. So essentially, you have to apply for certain dates, and there are more available in Ireland itself, but obviously Malaysia now has been included as one of the sites for people to sit for the exam. Next. So a lot of people might ask me, oh, so you finished your MRCPI in Ireland, why would you consider America as your training post? And this is what I will share with you, why I would have made that choices before I go into explaining to you what the USMLE and residency program and the rest are. Essentially, when I was a medical student, I was not keen at all to go to America, because during that period of time, I heard from colleagues, as well as even in lectures, there are a lot of case lawsuit against doctors in America, and Americans are notorious to have been known of one of those groups that would like to sue doctors anyway. So that's why I have made up my mind at that point not to even consider USMLE and go to America. But when you start training, you start realizing what the opportunity lies behind that concern. And what America can offer is fast track your training so that you can actually obtain an attending position, which is equivalent to consultancy positions, in a very short period of time. The fastest would be about 3 years. So if you finish the internal medicine residency within 3 years period of time, you are qualified to practice independently as a consultant physicians. So that's how I get to know from other colleagues who are working in Ireland, and that's how I made my mind up, saying that I would give it a try and see how it goes. And at this position, I can share with you that it is a very fruitful journeys to go through residency program as well as the fellowship program, because in 5 years time, I completed the whole endocrinology training, which cannot be offered by Ireland. And to obtain an independent consultancy position in Ireland sometimes can be very difficult, because you have to wait for a consultant to retire so that their position is vacant for people to fill in. So what I'm going to talk to you from now on is basically to explain to you what United States medical training is all about. So in United States, you have to start after finishing your medical school, you have to start with residency program. And the residency programs are basically divided into two big groups of what I'm listing down here. So there on your left-hand side, you have pediatric, internal medicine, general surgery, and cardiac surgery. Those are the standalone residency program. Essentially, once you enter this program, you will complete all the training within that specialty or that field. Whereas dermatology, plastic surgery, emergency medicine, neurosurgery, urology, those programs have to have 1 year of preliminary year first before you can join the program and finish the training in those respective field. So and so that will prolong your training by another year essentially. Next slide. So all the programs that are available in America, they are broadly divided into 3 types of programs. One is university affiliated. What it means is that a university has its own local, their own medical schools, and their residency program are tied to the medical school itself. So that is the highest tier program. Usually those programs are really competitive, and they usually are basically accepting more Americans over non-American graduates. And the second program are university affiliated. What it means is that the university, the program itself is affiliated to a university or a medical school, but on its own campus, which is the hospital, it doesn't have a medical school on site. And then the third tier is community program, where they are standalone hospital and community, where they have no affiliation to any university or medical school at all. So those are the lowest rank program if you're going to try to rank all the programs that you have interviewed with. Next. So how do you, what are the steps to get to your residency? So you have to finish and complete the USMLE exams. So in essence, you have to finish USMLE step 1, which is your basic science examinations. USMLE step 2 CK, which is the clinical knowledge, is a multiple choice exam again. USMLE step 2 CS, which is a clinical papers, where you have to go through like an OSCE exam, but the only difference is that your patients are not actually patients, they are actually actors, and you have to actually go through the stations. I believe it's about 8 to 10 stations for that exams. And upon finishing all these 3 papers, you then can apply for the certification. So if you passed all your exams, then they will, the ECFMG, which is the body that governs all the non-United States medical graduates, will issue you the certificates, and then you are good to apply for residency program. Now there is another USMLE step 3, which you can choose to do it either before you apply for residency or during your residency program. So I will kind of explain to you broadly why there will be a difference, because if you finish your USMLE step 3 before you actually apply for residency program, you are eligible to apply for H-1B visa, which is a work permit visa. However, because of the nature of the visa, there is a limited sponsorship of the visa for residency program as well as the fellowship program. As a result of that, your limitations in terms of getting invited for interview might actually drop when you apply for H-1B. I believe there is some fees differences in sponsorship, so that's why most programs do not offer H-1B visa. On the other hand, if you finish the first 3 papers without the step 3, you will enter America with J-1 visa, which is a student exchange visa. And there are some rules apply for J-1 visa where you cannot apply for H-1B until you finish your training, and you have to transition into J-1 waiver visa before you can obtain the work visa. And that basically put a roadblock on getting a green card immediately after your training. Next. So here I'm just briefly kind of outlined those passing mark as well as percentage of success in passing the USMLE exams. And you can actually go online to Google ECFMG, and you can get the statistic of the breakdown of all the applicants for any of the program that you're interested, and see what are the average score, what are the percentage of success in matching, as well as what are the data that they have collected over the years regarding all the applicants. So those are the information that you can get that online through ECFMG website. Next. So when I applied for US residency, there was a lot of different bodies or different processes that you have to kind of get yourself familiar with, and sometimes you can get lost easily. So you basically have three main governor bodies that actually involved in the process of applying for residency. So the first thing, it would be ECFMG, which is the third column. So ECFMG is the one that will be in charge of your USMLE exam, as well as the applications, and issue you the certificates. Once you get that, depending on the time, in the United States, the intake of the new batches start in July. So the applications for your residency program would usually start around September, and I will outline the timeline of your applications month through the years, and just kind of show you when you start. So the first thing you would want to apply for is apply through the ERAS, Electronic Residency Application Service, where you put in your CV as well as your personal statement and all your qualifications. You submit to them. Once you submit them, they will be opening up for application by around September, I believe, where you can start applying to individual programs that you are interested in. And upon applying for that, after the interview, you will then rank all your programs through this National Resident Matching Program, where you have to register on the website, and then you basically rank all the programs that you would like to join. So those three are the major bodies that you would need to be familiarized with, because any misstep will actually affect your applications. So next. So so all the applications are done through online process. The ERAS for your CV and credential, the ranking is to the RUMC, as I mentioned. If you're interested in applying to California State, you need another documents called PTAL, approved first before you actually can apply and work in California. So you have to have this done way before you actually start applying for residency program, and usually take about a couple of months before you can actually get the letter. So if you are anyone interested in California State, just need to make sure that you have the PTAL available when you are putting your qualifications on the ERAS. Next. So in June, you basically can open up your account with ERAS and put in all your documents needed. And then by September 15, usually that is the time where they will open up the applications for all the programs. And then on October 1st, they usually will request the dean from your medical school to release the documents and the letters for all the program that you apply to, so that they can receive one copy. And then by October 15, roughly around that time, the interview will start until about January, sometimes February even. And then your match result will be available around March, which I will show you on the next slide. Next. So so essentially, when you receive all the interview, you have to interview with the program individually. So there is a lot of coordination during that interview seasons where you have to fly around. I'm not quite sure with this COVID-19 situations how they are actually doing. What I heard at the moment is that they are going to actually offer the Zoom meeting. So this year applicants actually would not have a chance to visit the hospital that they are applying to. But the good part is that you save a lot of money not flying around the states to try to go to from one interview to another. And then by about March, I think in the middle of the March, you will get the result whether you match or not once you submit everything by January or February. Next. So the visa, so let me just explain to you quickly about the visa, because I mentioned just now a little bit. So the J1 visa essentially will have a limit of maximum 7 years in total for you to complete all your training residency and fellowship. Some fellows who actually completed 7 years of that maximum year of training, wanting to extend another year of fellowship in subspecialty, well, the subspecialty, if you want to say it, they might be able to apply for another year of extensions, but usually maximum 7 years. So if you decide to stay in America, then you will have to apply for J1 waiver job through the in the underserved area where there is a lack of appeal for the American citizen to go to those areas. So they open up those positions for anyone who would like to apply. And it's through the Conrad 30 program. What it means is that on each state, there will be only 30 positions, no matter how big or small the states are. So California, Texas, and Florida are the bigger states where they are more populated. So those are the states that are very competitive for the program because they only have 30 programs available each year. And all fellowship programs sponsor the J1 visa, but not all sponsor H1B. So the H1B essentially is a working visa. There are limited programs, like I mentioned, for fellowship and residency. You can, during the interview, ask each individual program if they actually offer H1B. Some, if they really truly like you, they will offer you H1B. And what it gives you is that you basically can apply for a green card after you finish your 3 years residency. Whereas with J1 visa, you have to finish the 3 years underserved contract before you can actually start your green card applications. And with the H1B, you can also do locum at the hospital where you train to earn for extra income, whereas J1 visa are not recognized. Next. So the documents that you require upon receiving the offer from the residency programs are letter of good standing from the registered medical counselor if you have already started working like I have. So I have to apply through the Irish Medical Council. You need a statement of need from your home country Ministry of Health. And then you need to apply for state license depending on the state. Some states give you a partial license, some states give you a full license. So that process will be guided by your program coordinators. So there will be one person who actually will communicate with you and assist you in applying to all those licensing necessary for you to start working. Next. So my advice is that from my personal experience, I felt that if I have known that I would end up in America practicing year when I was back in medical school, I would have done the USMLE because a lot of the basic science stuff are basically what you learned in medical school. And as you started working, you slowly kind of forget about those basic medical science knowledges. So you end up have to go back to study very hard while you're actually working. So there was a lot of back and forth about, you know, how you're going to do it better, how you're going to, you know, devote your time to all this stuff. In addition to that, there are lots of documents that you need directly from your medical school to apply for USMLE as well. So even if you are thinking that maybe you want to go to America, give yourself, if it's within 5 years time, it's worthwhile trying to kind of initiate the process, because once you open up an account with the ECFMG for USMLE, I think it's good for about 5 years. And you can actually get all your documentations from the medical school while you are in medical school, instead of, you know, trying to contact with medical school later on to try to get all your paperwork in line to apply for it. But if you are not sure, or you think maybe not, then make sure that you keep in touch with an administrator so that when you need help, you know who to go back and ask for, okay? And then you always need to, when you apply for residency, you always need to kind of understand how competitive is it to get into the field that you really want. And sometimes the competitiveness can exclude you almost automatically even before you apply, unless you are really good candidates scoring all the high marks for your USMLE. Then sometimes you might need to divert your you know, your specialty to another one that is easier to get in. And then if you have any questions, we have a group of us on Facebook that we kind of communicate and help all the new applicants, especially to try to kind of like guide them through all the processes. And I'm more than happy to refer you to some of the Malaysians who had successfully obtained the residency program as well as fellowship, so that they can kind of guide you, because the last time I applied, it has been a good 7 years now. So things might have changed, but we always have more people who applied and come on board. So we can always find you the best advice that you need. Next. So how can you increase your chance of success in getting a residency program? The first thing I think is that you need to think about elective in the US. I would encourage anyone who is interested to get, at least one elective in America, so that you kind of understand what their healthcare system is all about, because American healthcare system is very different from what you will experience in Malaysia as well as in Ireland, because they don't have a government hospital. Every hospital network work on its own policy as well as their own rules. So understanding how their medical system work can give you an edge in your applications, because you can basically apply to that when you're being interviewed, so that you show them that you know well enough their medical system. Try not to apply or graduate more than 3 years from medical school. When I applied, I was already 5 years out of medical school. And when I finished my residency, I did ask my program director, is that a problem when I apply? And the answer is yes. The problem is that American likes new ideas, and they prefer to have new grads coming out from medical school to train them, rather than having someone who had already set their own way in doing things. So the reason why some program would actually consider candidates who have graduated more than 3 years, partly because of the concern that they might have not able to get more residents. And my program is it's very Irish oriented, in the sense that they actually recruit a lot of Irish graduates, and they actually went to RCSI in Ireland to try to recruit residents from the RCSI and Irish candidates. So that was a good window or opportunity for me to actually join the program. And then obviously the USMLE score should be good. I mean, in general, in the old days when we use percentile, you always hear that people are scoring 98, 99 percentile, almost like everyone. I'm not quite sure how true that is, but every year what I heard is that the average USMLE score has gone up significantly. So when I set for my USMLE, my score was 240 something, and that was actually good enough to apply for Mayo Clinic. But by the time I graduated my residency as well as fellowship, 240 something is actually considered average only, and most people get 260 plus in terms of their scoring. So that changes year to year. So it's best to kind of ask around whoever just finished the exam and figure out like what kind of score you should get. And the general rule of thumb is that you should try to score high on your first attempt, and try not to fail on your first attempt, because there are people who fail the USMLE, end up retaking it, and that will actually be recorded down in the ECFMG. So that will actually affect your chance of getting into residency program. And then you should look at their residence background. So almost all the programs will have a web page that you can go on, and then you can look up all their residents background who has graduated, and see how many of them are international medical graduates and how friendly they are with international medical graduates, so that you know which program will actually have higher probability of actually accepting your applications. And then apply as many programs as you can before the ERAS closes, because each applications are kind of expensive once you hit about 40 programs, because I think the first 20 programs are the cheapest, and then every 10 program afterwards, each one of them costs you quite a bit. So the cost will rack itself up. But what you need to know is that on the first go, you should apply as many as you think you should, and generally that will be around 60 to 70 programs at least, because that will increase your chance of getting enough interviews so that you can get matched to the program. And then when you receive all the invitations, you would hope to receive a minimum of 7 programs invitations, because that is the magic numbers that it's been published before to successfully get matched into a program. Next. So so these are just basically the statistic that I got from the ECFMG, how high the chance of for international medical grads comparing between 2018 and 2019. And I said before, you can go on the website and then check it out on a yearly basis, especially the year that you're applying, so that you can see what are the chances. I think this year, well, the next year or this year, there will be a higher chance for you to get into the residency program, because America, with the COVID-19 crisis, I think they really truly see that they need a lot of doctors to really overcome all these difficulties in terms of battling all this pandemic stuff. So the chance for next few years might be actually increased for international medical grads. Next. So once you finish the training of your respective specialty, you have to sit for a board exam and then to get it certified. Next. Okay. So in conclusion, essentially what I want to say is that your journey doesn't end with medical school final exam, because when I was in medical school, I always thought that final exam is the toughest, and by the time you finish it, it's the end. But in reality, you have a lot more exam. As you can see, you have like MRCP if you want to apply for specialty in Ireland or UK or Malaysia or Singapore, and then you have USMLE to sit for, and then board exam afterwards. However, what I want to point out is that at every stage, you have to kind of look at what are your ambitions, what are the career opportunities available, what are the what is your goal to try to plan your way through, because in medicine you have a lot of options essentially, and you know when you step into medical school, the first day you say I want to be a neurosurgeon. By the end of your medical school, that will change, and same thing will happen when you start working. Your goal as well as your interest might change as well. So try to look out for other pathway or other opportunities. Look into it. You don't necessarily need to take it, but it opens up an opportunity, and PMC has opened up the opportunity for me to really kind of step outside the Malaysian system to go to Ireland, and through there I decided that I will try to explore America. That's how the opportunity arises. And then lastly is financial returns. So Americans are essentially paying doctors way more than any other countries in the world for the amount of work that they need to do, and that's my truthful, honest opinion. I know that being a doctor, you should not talk about all about money, but medical school are expensive, and when you start working, you realize that you will be working very, very hard, and that is a reality for you to start learning and to be a good doctor. But the questions that I had when I was working in Ireland is, how many more years can I do overnight 36 hours call before I tell myself that enough is enough? And that's when I started making choices of trying to secure a pathway where I can complete my training very quickly, so that I can actually end up with a job that I'm happy with. And when you practice independently with a good, obviously, economy, financial return, and that will help you to make your life fuller. So the job satisfaction will increase as a result of that, instead of you just kind of go into work, do on calls multiple times a month. And that's my thought, but feel free to disagree with me. Next. So we have about 20 minutes time, so I'm more than happy to take any questions if anyone had any.
Thank you so much, Dr. Tan. Okay, that was a very insightful session, and I'm sure the participants would have really benefited from your experience and also sharing today. So we have some Well, we have quite a number of questions. We'll try to answer all of them with the limited time that we have. However, if we are not able to answer some of the questions, we will get back to you after this session. Okay?
Okay,
So
sure.
there's one question, Dr. Tan, from Hugh Coyle. He's saying he's a Irish, US, and Malaysian citizen. Okay. So how do I have a good chance to get a US residency after my studies? I'm hoping to do the 2.5 years in Dublin and 2.5 years in Penang.
Okay. So as far as I know, if you're Malaysian, you cannot have dual citizen. So which nationality are you holding? But if you're American, so if you're holding American passport, your chance of getting the residency is higher than non-Americans because the visa component will be out of the questions. So that means that the program will look at it and say, if you get a good score, you finish your medical school no matter where you came from, but you're American, you don't need a visa, then they will actually consider you higher ranking than non-Americans who need visa.
All right, so I hope that answered your question, Hugh. Right, we have another question from Neil Jack. Do students get to work in Ireland? What is the success rate?
Pardon?
Okay, so I think, do students get to work in Ireland? What is the success rate? I think he's asking, like, if we do the RUMC program or the RCSI program or UCD program, what are the chances of you to work in Ireland?
Okay, so
Yes.
the internship might be competitive, but PMC, RUMC have actually make it kind of easier to apply because the intake in Ireland is in July, and we used to graduate in July 1st or the first week of July. So we always missed out the chance to apply so that we can get into that workforce because the Irish graduates around May, and then they start applying for their internship during that period of time. And by the time you finish your final exam, as far as I remember back then, it was middle of June. Those position has been taken. So at this moment, I think your chance is as good as what the Irish grads would be. However, that really depends on how many grads per year, because in Ireland, there is always a certain amount of positions available. So there is a limitations on how many interns can they train a year. So that still will fluctuate year by year because every year you will have an influx and efflux of medical graduates, depending on those who had finished their full 5 years program in Ireland, where they are not Irish, and if they decided to stay in Ireland, then you are competing with them. So that really kind of change from year to year. However, if you are talking about SHO positions, senior house officer positions, that will have a lot of opportunities because they always have openings, you know, and they always never actually get 100% intake for their program. So you end up at the last minute, they will still have availability for you to grab. So
Great.
yeah.
Okay, thanks, Dr. Tan. There's a question from Dayang Anis binti Awang. Is it necessary to get 3 LOR from America to apply for the interview?
Oh, letter of recommendation. Yes, you have to at least have 3 letter of recommendations, because anything less than that might actually affect your chance. Just because in America they made it a point for all candidates to get at least 3. So you're competing against people who have 3.
Okay, great. Okay, Mr. Lim Gi Keong is asking, hello there, can I know where I can get the study materials for USMLE, and do you advise Kaplan?
Yeah, Kaplan textbook is good. But what I would also emphasize is that if you're going to sit for USMLE, you should go online to find the latest question bank, so that you can actually start doing the questions instead of just focusing on studying. The trick about, you know, sitting through all the exam is that USMLE is the challenges is that it's a very long exam, lasting about 8 hours. durations in total, the shortest. So what it means is that you need a lot of mental capacity to really sit through the exam. Not how much you know, how much you can endure the exam. And the best way to practice is actually understand how they ask you the questions. You know, knowing the knowledge and then translating into answering the questions might not be the same. So if you can actually, you do continue study your textbook, and because more or less you will see some similarity between your medical textbook as well as their syllabus. But what is more important is that you start looking at the question bank and start going through all this so that you can actually train your brain to actually think the way they ask you in terms of how they're going to ask you, and that will help you to adapt more to the exam environment.
Okay, great. Okay, will RCSI give me the support to pass my USMLE exams? Will they support me during my Penang years? You.
I'm a graduate from UCD, so I can't tell you. But
so it's the same. Yeah.
Yeah, so what I might say is that when you are in RCSI, the time that you spend in Ireland, you should actually try to ask around if you're interested to go to America, how your colleagues or how your classmates are sitting for their exam, how do they do it, and as far as I know, RCSI have some of the pre-arrangement in terms of elective positions with some of the major hospitals. I know RCSI graduates who went to Cleveland Clinic for her elective, and I know someone from the RCSI as well going to Temple University in Philadelphia. So it's worthwhile to kind of ask around people and then also ask the administrations and see if there is any affiliated program that they already have relationship with in America, so that you can actually try to use that pathway to apply for your elective. There's no harm of trying that. I mean, ultimately, you know, worst case scenario, they say no, but you never know what your chances.
Maybe I can take the second part of the question. Will they support me during my Penang years? Certainly. We do provide guidance on students who would like to go for the USMLE program. Even Dr. Tan, when he was here, the last time he actually was here giving talks to our current students. So we do provide a lot of guidance to students who are interested. The thing is, like what Dr. Tan shared earlier, you have to start early if you're applying for your residency in the USMLE practice. So if you're going for the exams, you have to start early. By your third year, Dr. Tan?
Yeah, around your third year, I think.
So we, as while you're in your clinical years, there will be talks from our alumni like Dr. Tan, our academics as well, and we will provide materials for you to prepare. Of course, the application will be on your site. Okay. So next question. Wow, there's a lot of questions today. Okay, this one is nice. Vanessa, she's asking, can you share with us your experience as a doctor? Okay.
That is a very broad.
Yeah.
So, as a doctor, I don't think I can give you an answer, to be honest with you. The way I look at medicine is a philosophy, so it really kind of bring together what you feel that you can help or you can provide to your patients. What are the goals that you look in achieving that, and how you can make it happen. And it really depends. If you're medical students, you might look for an answer that will look very different when you start working. So I don't have one answer for you.
Okay.
That is for you to find it yourself, your inner call that will guide you through your medical school, and then as well as when you start working, because things will change. I can promise you that things will change. So I apologize, I can't share with you how it feels like to be doctors in my own term. I don't see as, you know, you are high and mighty as a physician or as a doctor. So I will just leave it there, if that's okay.
Okay, Dr. Tan, no worries. So there's a question from Chi Lee. How long is the Conrad 30 program?
So the Conrad 30 is 3 years essentially. So you have to complete the 3 years waiver job. However, I also forgot to mention, so if you finish your residency and you decided that, okay, I don't want to do this 3 years in a rural place in America, which in many cases, not every positions are in rural areas, is underserved. So the underserved area can be found in big city like Chicago, Boston, as well as New York. It's just that it's not the center of the city where the big hospital, big university hospital will offer you. Some university
Okay.
hospital, if you're really good, like in research and all this, they can actually offer you something similar. They can create a positions where you can actually see patients in underserved area in the city itself, but also grant you a position as academic physicians. So there are ways, if you're really high achiever, you can actually achieve that level. I salute you and I would encourage you to go for it. But if you choose saying that you don't want to work for this 3 years, you decided to go back to your hometown. If you go back to Malaysia for 2 years and then you decided to come back to America, you can actually apply for H1B at that point. So you kind of skip that 3 years of the J1 waiver.
Okay, great. Thanks. Rama Vaish is asking, how did the RUMC program help you in gaining overseas internship? Please give some insights. I'm thinking of practicing my medicine overseas.
Okay, so RUMC gives you one extra edge in comparison to all the local university program in the sense that it's recognized in Ireland as well as Malaysia. That is the starting point. Now, for America wise, as long as you complete your USMLE, no matter where you're from, they will recognize you.
Okay.
So that's additional steps that you take upon yourself to try to get it. So that privilege will be the same shared with all the medical school around the world. But RUMC itself will give you an opportunity to work in Ireland automatically without much of the hindrance that you have to go through all the paperwork and all of it.
Great, thanks, Dr. Tan. Antonio Tan is asking, hi, is the Ireland internship program equivalent to a residency program?
No, they are not. So when I went through the whole training process in Ireland from SHO to registrar, what I realized when I started residency program is that the training style are very different. The American talks a lot about evidence-based medicines and also autonomy for you to make decisions. So if you start as a SHO in Ireland, you basically are the lowest rank, just like the MO in Malaysia. You don't have a say to make any decisions unless your boss say yes. So you basically work under somebody and you carry out their duty. You're not making medical decisions. You are not really actively recruiting that confidence of making those decisions. Whereas in America, because their training is so short, so 3 years of internal medicine will complete the whole, you will then become an independent physician. During that 3 years, they really need to get you to understand that how to make the decision, why do you make that decision. They will train you well enough so that when you come out by the end of the 3 years, you can actually practice independently. So that is a very different style of training. So even when I have completed my my registrar positions, a year of registrar position in Ireland, when I come to America, I still have to take a couple of months to get adapted to the way they actually train their residents. And I have to say that it's more of the, you know, understanding what your responsibility that make you a different physicians, even if you just came out from medical school, if that makes sense. So even if you graduated and then you're thrown into this residency program, what difference it makes is that it makes you more independent in terms of making your own clinical judgment, making your own clinical decisions, carry it out, instead of being an intern where you just basically take blood, do all the duties that your boss asks you, and you really do not actively learn at that point, if that makes sense.
Okay, all right. Okay, so hi, let me just look at some different questions here. Diane is asking, is it possible to have an observership with you in the US? He.
Okay.
So she's asking if she can shadow you, I think, is it?
Shadow me, observation. What I can tell you is that observership does not provide you any edge. When I applied for residency, I did ask one of the consultants whom I work with in St. James's Hospital in Ireland. He was a cardiologist in UCLA, decided to go back to Ireland to work. But then after a year in Ireland, he decided to go back to UCLA because I don't know what the reason is. But I did ask him when I was applying for residency program whether observership is worth it or not, because getting an elective is not easy. You have to pay money, you have to arrange all this accommodations and all this travel. And at that point I was working, so I don't really have that many weeks of doing this elective. And plus you have to kind of like write to each hospital or program to really apply for it. So I asked him for observership. What he told me is that it's not worthwhile to do observership because it really does not add on anything apart from your time, your travel, and your expenses.
I see.
Because it doesn't add any edges. Observers basically are just sitting in the office and then you just observe. You're not making decisions. You're not actually being evaluated for anything. Whereas elective in America is very different. They have a program that basically will assess how you do, and they basically expect you to work as like an intern, able to actually talk to patients, examine the patients, and then come up with your plan. And they basically assess you through the process, and then at the end of that, they will give you an assessment report, and that is what will help you in your applications.
Okay. Thanks, Dr. Tan. Okay, we have a question from Vinny. She's asking, do you think securing a residency position in Canada will be similar to the one in the US?
Would
you be able to shed some light?
Canadians residency is very different because Canada has this government program, so they really kind of limit how many applicants. And as far as I know, even Canadians have difficulty in getting back to their own country when they finish their study either in in Ireland or US. So that questions I cannot answer you for sure, but as far as I know, the structures are slightly different and you might have to do more research on it.
But there are many Canadians who do the USMLE, who go into the USMLE as well, right?
Correct. Because the whole reason why they decided to go with USMLE is because the opportunities of job opportunities are more available in US instead of Canada, because Canadians are quite saturated in terms of specialists. So if you really do specialty, there might be it might be very difficult for you to get into. But we do have a graduate who is currently working in Toronto, who graduated back in 2006, a senior of mine.
Okay.
And, yeah, so maybe he would be the best person to really talk to.
Okay.
Yeah.
Right. Okay, so let me just take maybe another 2 questions. The rest of the questions probably we will answer after this. We will get back to you in writing. One moment, let me choose a question here. Okay, Faizul Fitri. Hi, Dr. Tan. Thank you for your insightful talk. In regards to your working experience in Singapore, Ireland, and in the US, which one provides a better working environment as well as more educative? So I think that's a very good question, since you have all the experiences, Dr. Tan, in all countries.
I would say America would be the one who offer you the most medical training in respective of because the reason why I would say that is because even in Ireland, the SPR who actually completed their 5 years program of their training, most of them will actually come over to America for fellowship, because like I said, consultancy position in Ireland is limited, so they have to get more training while waiting for positions, and majority of them choose to come to America for further training in their specialty. So that pretty much answer everybody's questions. Which one is better?
Which one is better? Thanks, Dr. Tan. Okay, we have a professor who just joined us, Professor of, our head of psychiatry is saying he went through the Canadian program. I think that will be a good answer for Vinny. Vinny is going to be joining our program in September. Thank you. That's just for information. Thanks, Prof. Andrew. Okay, one last question before we finish. Okay, Vanessa is asking, at this point of time, if I'm not sure whether medicine is a course that is suitable for me, what advice can you give me?
Okay. So this is my belief. Okay, don't take it as the pillar of your life, but this is my belief that when you come into medicine, it opens up a lot of options for you in the later part of your life. However, you also need to know that this is a very specialized field, that once you get into it, when you want to change it to something drastic like engineering and all this, you have to start from scratch. But in medicine itself, you have so many specialties. You can choose to be an administrator if you like to. You can go to research if you prefer research over clinical positions. So you really want to kind of look into like what are the choices that you were made if the option number one is not your, not your ambitions or your goal anymore. When you switch over, will it still being covered under the umbrella of medicine? So the answer can be yes and can be no. But it does open up a lot more opportunity in comparison to other like engineering field and others.
Nice. Okay, so we have many questions. Maybe we can send it all of these questions to Dr. Tan later, because most of it are regarding the USMLE practice, Dr. Tan.
Okay.
Thank you so much. It was a very insightful session, and I really hope that all attendees benefited from the session. I'm confident that you would have. If you have any question, please write to us on enquiry@rcsiucd.edu.my, and we will try our best to get back to you as soon as possible. So, Dr. Tan, thank you so much. We hope to speak with you sometime soon.
Okay, will do.
Okay, have a nice evening.
Okay, thank you.
Bye, everybody.
Bye-bye.